Okay, so let's go back now to, again, the same type of line with chronic otitis surgery without cholesteatoma, and just to study, for example, the Myringoplasty. So I go to primary surgery, for example, on the tab 1, then I will go to clinical, and I will go to the line otoscopy. You can see tympanic membrane perforation here, more than 1,000 cases, and I'm going to click on that tympanic membrane perforation. I'm talking about Myringoplasty, which means only tympanic membrane grafting without any other type of surgical technique like ossicular chain problems. So I want to select that. That's important. If you look to this tympanic membrane perforation, you have the description of the different perforation that you can see here. Sometimes you have two type of perforation on marginal. This is why the number here is larger than this one, for sure. So let's say, for example, you also have the type of the etiology of the perforation on tab 2. So you can study the results according to the type of perforation. Now, if you go to surgery, also you can describe the procedure and choose the procedure. So you have Myringoplasty type 1. So that's the one I want to study. So I'm going to click on that, and the program will select 917 cases. Of course, you can see that there are different pathology which are associated, but because I select on Myringoplasty type 1, I was not doing any ossicular reconstruction, probably for some reasons, probably because there was tympanosclerotic stapes fixation like this. So let's say that, of course, I want to remove some of this associated pathology, so I need to remove all these things. So, well, let's go for, no, it's better, by the way, to use known. Associated pathology, 483 cases. So if by clicking on this line, it's clear that the program will select only cases with tympanic membrane perforation. And you can see there's a line here, cholesteatoma, but that was only a very limited cholesteatoma, like a pearl. So we are not in case of a real middle ear cholesteatoma. Otherwise, this will go to another specific part. Now, you see, you have the type of grafting that I was using, perichondrium in all cases, and some cases of total strap removal, which I introduced also, which is a technique which was used in the past, and sometimes I use it. And so, if you go back to clinical, then again, we have 483 cases, and you can describe that we have central posterior, central inferior, anterior, subtotal, etc., etc. And of course, if you click to ossiculoplasty, it's clear that you have 483 cases without ossiculoplasty, because that's a Myringoplasty only. So again, if you click to with pre and post-op, then immediately you get the post-op results. And if you go to post-operated like this, you can see you can have access to complication, and you can also have access to aspect of the tympanic membrane. So you know exactly how many failures in terms of tympanic membrane perforation you have, of tympanic membrane lateralization, blunting, etc., because everything has been included there. So you can find them already. So I'm going to click on surgery result by pathology, and I go back to Myringoplasty, which I think was interesting because I want to study my own failure in case following Myringoplasty. So to do this, I need to go to revision surgery first. So I will select, and this will create this one, select this 1,978 cases. So I need to select my personal revision. So I need to go to tab 2, clinical. And then I have to go to personal revision, chronology, first personal revision. So let's go and find previous surgeon. So we are here aligned on the tab clinical, personal revision chronology. I want to study my first, like I do for stapes. I want to understand why I failed. So I'm going to click on first personal revision. Personal revision. So definitely that's my personal failure. Now, if we go to otoscopy, because of course that's the entire series of tympanoplasty with and without ossiculoplasty. So we need to select tympanic membrane perforation. That's it here. So we go to tympanic membrane perforation, 99 cases here. Then we go to tab 3, surgery. And I have to select ossicular chain technique, no. And then I need to understand what was the cause of failure. So let's go to the main cause of failure. So you can see when the previous operation, I have to select the previous operation as a Myringoplasty. So we go to previous operation, I click on Myringoplasty here, and I got 39 cases. So definitely I know that now I'm following my results, my failures, following previous Myringoplasty, and you can see that the main cause of failure was tympanic membrane perforation in 39 cases, but you can study, because if you click on list of selected cases, then as I previously described, you have access to the list of patients and you can open up each patient.